Are you aware of the warning signs that could signal colon cancer? This is crucial information that could make a difference in early detection and treatment. In today's video, we'll reveal 8 important symptoms you should watch for. These signs are often subtle, but they can indicate something serious. Stay tuned as we discuss what to look out for and why these symptoms matter. Your awareness could be life-saving. Don't forget to subscribe to our channel for more vital health information and updates. Changes in bowel habits. One of the early signs of colon cancer is a noticeable change in bowel habits. This can manifest as diarrhea, constipation, or a change in the consistency or shape of your stool, such as narrower than usual. These changes might be persistent, lasting for more than a few days, and aren't related to dietary changes or other common causes, stress or minor infections. You may also notice a difference in the frequency of bowel movements, whether it's going more often or less frequently than normal. These alterations can indicate a blockage or narrowing in the colon caused by a tumor. It's crucial not to dismiss these changes, especially if they occur alongside other symptoms like abdominal pain or blood in the stool. Early detection of colon cancer significantly increases the chances of successful treatment. Blood in stool. Blood in the stool is a significant and concerning symptom of colon cancer. It can appear as bright red blood or darker, tarry stools, indicating the presence of bleeding higher up in the colon. This bleeding occurs when a tumor disrupts the blood vessels in the colon or rectum, causing blood to mix with the stool. Sometimes, the blood may not be visible to the naked eye, which is known as occult blood, and can only be detected through specific medical tests. It's important to note that while blood in the stool can be caused by other conditions like hemorrhoids, anal fissures, or inflammatory bowel disease, it should never be ignored. Presence of blood, especially when accompanied by other symptoms, such as changes in bowel habits, abdominal pain, or unexplained weight loss, warrants immediate medical attention. Early investigation and diagnosis are key to determining the cause and ensuring timely treatment. Regular screening, especially if you're over 50 or have a family history of colon cancer, can help catch this symptom early and increase the chances of successful treatment. Persistent abdominal discomfort. Persistent abdominal discomfort is a common but often overlooked symptom of colon cancer. This discomfort can include cramping, gas, or a general feeling of bloating and fullness that doesn't go away. The pain may be mild and intermittent or more severe, often described as a dull ache or sharp pain that doesn't seem to be related to eating or other digestive issues. This discomfort can be caused by a growing tumor that obstructs the bowel, leading to pain and a sense of pressure in the abdomen. As the cancer progresses, the discomfort may become more constant and difficult to relieve. Typical remedies like antacids or over-the-counter pain medications. It's important to seek medical evaluation to determine the underlying cause, as early detection of colon cancer greatly improves the chances of successful treatment. Unexplained weight loss. Unexplained weight loss is a concerning symptom that can be associated with colon cancer. This refers to losing weight without trying, where there is no change in diet, exercise, or lifestyle to account for the weight loss. In the context of colon cancer, weight loss often occurs because the cancerous cells consume a lot of the body's energy. Additionally, as the tumor grows, it can cause blockages in the colon, leading to reduced appetite and difficulty absorbing nutrients. The body's immune response to cancer may also contribute to weight loss, as the body uses more energy to fight the disease. Sometimes, the presence of a tumor can cause metabolic changes, leading to unintended weight loss. If you experience significant, unexplained weight loss, typically defined as losing more than 5% of your body weight in 6 months, it's important to seek medical evaluation to determine the cause. Early diagnosis is key to effective treatment. Fatigue or weakness. Fatigue or a persistent feeling of weakness is another symptom that can be associated with colon cancer. As the cancer progresses, it can lead to internal bleeding within the colon, which may not be immediately visible but can result in a slow loss of blood over time. This chronic blood loss can lead to anemia, characterized by a reduced number of red blood cells, which are essential for carrying oxygen throughout the body. The result is a feeling of exhaustion, weakness, and a lack of energy. even with minimal physical activity. Cancer cells also consume a significant amount of the body's energy, leading to a general feeling of malaise and weakness. Fatigue associated with colon cancer can be profound and may interfere with daily activities. If you experience unexplained, persistent fatigue, especially when accompanied by other symptoms like changes in bowel habits or weight loss, it's important to seek medical advice for further evaluation. Early detection can significantly improve treatment outcomes. Feeling that your bowel doesn't empty completely. A sensation that your bowel doesn't empty completely, also known as tenesmus, is a common symptom of colon cancer. This feeling can be frustrating and uncomfortable, as it gives the impression that there's still stool left in the rectum, even after a bowel movement. This symptom often arises because a tumor in the colon or rectum is obstructing the passage of stool, preventing a complete evacuation. As the tumor grows, it can cause a narrowing of the colon, leading to partial blockages that make it difficult for the bowel to empty fully. This sensation may be accompanied by other symptoms, such as abdominal pain, bloating, and changes in bowel habits like diarrhea or constipation. The feeling of incomplete evacuation can also lead to frequent, urgent trips to the bathroom, with little or no relief after a bowel movement. Consulting a healthcare provider is essential to determine the underlying cause, as early detection of colon cancer is critical for successful treatment. Iron deficiency anemia. Iron deficiency anemia is a condition that can be an early sign of colon cancer. It occurs when there is a lack of healthy red blood cells due to insufficient iron in the body, which is essential for producing hemoglobin, the protein that carries oxygen in the blood. In the context of colon cancer, anemia often develops because of chronic internal bleeding within the colon or rectum caused by a tumor. This bleeding is usually slow and may go unnoticed as it may not be visible in the stool, leading to a gradual depletion of the body's iron reserves. As a result, the body struggles to produce enough red blood cells, leading to symptoms of anemia such as fatigue, weakness, pale skin, shortness of breath, dizziness, and headaches. Anemia caused by colon cancer is often diagnosed through a routine blood test, showing low hemoglobin levels. If iron deficiency anemia is detected without an obvious cause, such as heavy menstrual periods or a poor diet, it's crucial to investigate further to rule out serious underlying conditions like colon cancer. Early detection and treatment are vital for a better prognosis. Persistent cramps or gas. Persistent cramps or gas can be a subtle but important symptom of colon cancer. Unlike occasional digestive discomfort that most people experience, the cramps and gas associated with colon cancer are often more consistent and don't resolve with typical remedies like dietary changes or over-the-counter medications. These symptoms may be caused by a tumor in the colon, which can obstruct the passage of food and gas through the digestive tract. As the tumor grows, it may create partial blockages that lead to a buildup of gas, causing bloating, cramps, and a general feeling of discomfort. The cramps may be mild or severe and can occur frequently, sometimes even without a clear trigger like eating. This persistent discomfort can also be accompanied by changes in bowel habits, such as diarrhea, constipation, or a feeling that the bowel doesn't empty completely. Early investigation can help identify colon cancer at a stage when it's more treatable, improving the chances of successful outcome.